The World Health Organization warned that the combination of the Delta and the Omicron variants could create what they called a tsunami of infections worldwide.
To get some perspective on exactly what the concerns are right now, we're joined by Dr. Shira Doron, the hospital epidemiologist at Tufts Medical Center. Thanks as always for being here, Dr. Doron.
Great to be here.
You know, there's clearly a big concern right now about the surge of cases overwhelming healthcare systems, but there was some positive news here too about vaccine protection, right?
Definitely. So what that means is that as a healthcare worker, I'm very worried about the potential for a hospital surge, but as a fully vaccinated person, I'm not worried about my safety or that of my family. So if I could ever leave this hospital, I would feel comfortable doing the things that are important to me, despite the risk of catching Omicron. I know it's likely to be mild.
But we don't want to overwhelm the hospital workers either. You guys have had your hands full for so long now. We also want to ask you about some interesting new research getting some attention out of South Africa. Scientists there say it seems people who've recovered from Omicron are better able to fend off Delta. Or is that another sign that Omicron's just taking over? What's your take on that?
You know, because people who have had Delta infection have been getting infected with Omicron, the big concern was that people who had Omicron could then get infected with Delta, thus creating that tsunami you were talking about with Omicron and Delta together. But if Omicron protects well against Delta, that's good news. It doesn't mean that Omicron will take over, but it means that it will likely leave immunity in its wake, even if Delta continues to circulate.
Okay. We know now that Massachusetts has passed more than 1 million cases since the pandemic began. Daily case counts are hitting new records. When you look at those numbers, though, what about that concerns you the most?
Well, to be totally honest with you, I'm worried about what happens when people panic over those case numbers and make decisions that could be harmful. So I'm worried about school children and college students. They need to stay in school. They need sports and arts and socialization, and it's safe for them to do those things. And I worry about new rules imposed on them that could affect their mental health.
Well, we have to ask. New Year's, of course, is days away. Should we be staying home this year?
If you're unvaccinated, absolutely yes. If you do not want to get COVID because you're vaccinated but vulnerable, or you just don't want it, yes. But if you're vaccinated, and especially if you're boosted, and you don't mind getting what is most likely going to be a mild flu-like illness, I say it's fine to socialize.
All right. Dr. Doron, we appreciate your insight as always. Thank you.